All right, welcome to The Explainer. Today, we're diving into one of the biggest, most fascinating paradoxes in modern medicine. We're talking about a new class of drugs so revolutionary they're being called a miracle cure for obesity. So, why did the company that invented them watch its stock absolutely crater? Let's get into it. So, on the one hand, you've got this incredible promise. A magic wand for obesity that created a multi-billion-dollar market almost overnight. But then you look at the other side of the coin, and it's a completely different story. The pioneer, the company that started it all, sees its stock just collapse, falling from a high of over $140 all the way down to $45. And that brings us to the big question for today. How on earth did the inventor of a miracle drug manage to fumble its massive, massive head start? The answer is pretty surprising. It doesn't start in a boardroom or on the stock market. It actually starts with a tiny little hormone inside our bodies. Yeah, to really understand this business story, we have to rewind the clock a bit. The story of this drug revolution actually begins decades before anyone was even thinking about weight loss. It all starts with this tiny, kind of overlooked hormone that acts like a really smart thermostat in our system. Meet GLP-1. Now, this was discovered way back in the 1980s, and at the time, researchers were only looking at it for diabetes. They figured its main job was just to help regulate blood sugar. But as it turns out, GLP-1 had a secret that was going to change, well, pretty much everything. To get why this was such a huge deal, just think about the main tool for diabetes up until then, insulin. Insulin is kind of like a sledgehammer. Yeah, it smashes your blood sugar down, but if you get the dose even slightly wrong, it can be really, really dangerous. GLP-1, on the other hand, it's like a thermostat. It just gently nudges your blood sugar down if it's too high or up if it's too low. It keeps everything perfectly in balance. For scientists, this kind of precise control was an absolute game changer. And that incredible science led to a total happy accident. You see, as companies like Novo Nordisk were developing these GLP-1 drugs for diabetes, they started noticing something really weird in their clinical trials. The patients, they were losing a lot of weight. It turns out GLP-1 doesn't just work on blood sugar. It also talks to the reward center in your brain, the dopamine system, and basically tells it, hey, you're full, we're good, you can stop eating now. And that was the light bulb moment. They realized, holy cow, this isn't just a diabetes drug. This could be a cure for obesity. So they'd essentially stumbled upon a modern-day gold mine. But as we're about to see, discovering gold and actually running a successful mining operation are two very, very different things. Just look at this timeline. It's wild. Novo Nordisk launches its big obesity drug Wegovy in 2021. By 2022, demand is exploding. It's totally off the charts. But right then, a rival shows up. The stock hits its absolute peak in the middle of 2024, and then, boom, a total catastrophic crash that wiped out almost two-thirds of its value. So what happened? Well, it wasn't just one thing. It was a whole cascade of errors. First off, Novo Nordisk, which is a pretty conservative company, just completely, drastically underestimated how many people would want this drug. They couldn't make it fast enough, which led to these huge shortages. That made a lot of people angry, including their core customers who needed it for diabetes. Their scramble to expand production just led to chaos. And then the final nail in the coffin, a massive gamble to get the drug approved for Alzheimer's, failed. They'd created a monster they just couldn't control. And while Novo was just trying to keep its head above water, its biggest rival saw the opportunity of a lifetime. And in comes Eli Lilly with their drug, Mounjaro. And when you put them head to head, it was just brutal for Novo. Mounjaro was a little bit more effective at weight loss. It had slightly fewer side effects. But here's the crucial part. Eli Lilly was way better prepared to manufacture it at scale. And to top it all off, their patents last longer. On almost every single front, Lilly just had the edge. In the pharma industry, there's this huge concept called the first mover advantage. Basically, if you're the first to market, you get this golden 3-year window to absolutely dominate before anyone else can catch up. Novo Nordisk had that window. It was theirs for the taking. And they completely squandered it because they couldn't get their supply chain together. It was a fatal multi-billion-dollar error. But here's the thing. This story isn't just about Novo versus Lilly anymore. Not by a long shot. The whole world has woken up to this market, and the race is getting really crowded. The success of these first drugs basically set off a bomb in the industry. It's a full-blown gold rush. Now you have giants like Roche and Amgen jumping into the ring, plus dozens and dozens of smaller startups, all trying to get a piece of the pie. And the technology itself is evolving at warp speed. We're already seeing the move from weekly injections to daily pills. The new cutting edge is something called dual or triple agonists. These are drugs that hit multiple hunger hormones at once for even better results. Some are even working on a monthly injection. The game is literally changing every few months. But for all the incredible science and the corporate drama, it's so important to remember that this magic comes with a serious price. And I'm not just talking about money. Let's start with the most obvious barrier, though, the cost. Right now, we're talking about $500 a month, out of pocket for many people. That's a huge financial burden, especially for a medication you might have to take for the rest of your life. And that high cost leads directly to this next number, which honestly is staggering. After just 1 year on the drug, half of all patients quit. 50%. Think about that. For a treatment that's supposed to be a miracle, a 50% dropout rate tells you there's a huge gap between the hype and the reality for everyday people. And there are other hidden costs too. The biggest one is what they call the rebound. The second you stop taking the drug, the weight almost always comes roaring back. Then there's the problem of muscle loss. If you aren't really careful about strength training, you can lose a ton of valuable muscle mass right along with the fat. And of course, you have the side effects. Common stuff like nausea, but also rare and really serious risks like pancreatitis. And all of this brings us to one final and maybe the most important question of all. At their core, these drugs work by silencing one of our most fundamental human drives, hunger. And while the short-term results are incredible, you have to ask, is chemically turning off that instinct a real long-term solution? Or are we creating a whole new kind of problem that we just can't see yet? Only time is going to tell.